Hello and welcome to Crack the Boards. This channel is dedicated to helping you excel in the USMLE by offering over 2,000 questions complete with answers, detailed explanations, and the rationale to deepen your understanding. We upload 2 new videos every week, so be sure to subscribe, like, and share to support the channel, stay updated on the latest content, and help others discover this valuable resource. In today's video, we will focus on USMLE questions related to gross anatomy and embryology. Let's have a look at the first question. A 65-year-old man with a 35-year history of smoking 2 packs of cigarettes daily reports needing to frequently clear his throat to remove mucus. Which region of the respiratory tract contains cells primarily responsible for mucus production? A. Alveolar bronchiole. B. Alveolar duct. C. Alveolar sac. D. Alveolus. E. Bronchus. Now the correct answer is E. Bronchus. This patient has chronic bronchitis, the most common lung abnormality in smokers. Cigarette smoking inhibits the motility of cilia, which are the small hairs located on the respiratory epithelium. The cilia normally function to move mucus up and out of the respiratory system. When cilia do not beat properly, mucus tends to stick where it is produced. The bronchus is lined with pseudostratified columnar epithelium that is ciliated and has goblet cells. These cells produce mucus, but the cilia are unable to move it along the bronchial surface toward the oral cavity. To compensate, the smoker must constantly cough to eliminate the mucus. The other options are incorrect because mucus-producing cells are not found in the alveolar bronchiole, alveolar duct, alveolar sac, or the alveolus. Let's have a look at the second question. A 1-month-old male infant is brought to the emergency department with reduced oral intake and 2 episodes of bilious vomiting. A barium enema radiograph reveals a dilated proximal segment of the sigmoid colon and a narrow distal segment of the sigmoid colon and rectum. Which condition most likely accounts for these findings? A. Congenital megacolon. B. Congenital omphalocele. C. Membranous anal atresia. D. Rectal atresia. E. Volvulus. The correct answer is A. Congenital megacolon. The patient has a gastrointestinal obstruction, most likely due to a congenital megacolon. This is caused by an aganglionic segment of colon, which results from a failure of neural crest cell migration. Let's have a look at why the other options are incorrect. B. Congenital omphalocele is persistence of the herniation of the intestines into the umbilical cord, resulting in a midline peritoneal covered sac protruding through the umbilicus and containing abdominal organs. C. Membranous anal atresia results from failure of the anal membrane to perforate and would not permit a barium enema to be performed. D. Rectal atresia is absence of part of the rectum due to abnormal recanalization or defective blood supply and would not permit a barium enema to be performed. E is incorrect because volvulus involves intestinal twisting due to improper mesenteric attachment, but does not align with the barium enema findings described. Let's go to the third question. A 53-year-old woman presents with a 3-day history of right upper abdominal pain radiating to her right shoulder. She has a history of gallstones and exhibits scleral icterus and jaundice on examination. Ultrasound reveals a stone in the common bile duct causing dilation. What changes in plasma concentrations of free and conjugated bilirubin are expected in this case? A. Free bilirubin high, conjugated bilirubin high. B. Free bilirubin high, conjugated bilirubin low. C. Free bilirubin low, conjugated bilirubin high. D. Free bilirubin low, conjugated bilirubin low. E. Free bilirubin unchanged and conjugated bilirubin unchanged. The correct answer is A. Free bilirubin high and conjugated bilirubin high. An obstructed biliary tract prevents the clearance of conjugated bilirubin, leading to its accumulation in hepatocytes and subsequent leakage into the bloodstream. This obstruction also impairs the conjugation of free bilirubin, resulting in its increased levels in the circulation. The other options are incorrect because in biliary tract obstruction, the normal flow of bile is blocked, leading to accumulation of conjugated bilirubin, which leaks back into the bloodstream and raises its plasma levels. At the same time, the liver's capacity to conjugate free bilirubin is exceeded due to the backlog, causing free bilirubin levels to also rise. Any option that suggests low or unchanged levels of free or conjugated bilirubin is incorrect because it does not account for these disruptions. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and support our journey.